Have you ever heard about CBD? Do you know what it's used for? Have you ever wondered if it really works or if it's just a bunch of hype? Today, we begin digging into CBD and its uses. By subscribing to my channel and hitting that bell, you'll be notified every Monday when I post a new video that will help you navigate the sometimes confusing healthcare system. In my practice as a pharmacist, I've helped many patients make wise decisions about CBD. CBD has become the latest fad. So what is CBD? Cannabidiol, or CBD, is one of the 113 identified cannabinoids in the marijuana and hemp plants. Cannabis has been used in Chinese medicine for over 4,000 years, so it isn't a new thing. While the main cannabinoid in marijuana is THC, or tetrahydrocannabinol, the hemp plant contains very little THC, but has a high concentration of CBD. In 2018, the Farm Bill federally legalized CBD that is derived from hemp and contains less than 0.3% THC, so CBD is legal in all 50 states. CBD produces very different effects on the mind and body from its cousin THC. CBD will not make you high. In fact, cannabidiol seems to negate the psychoactive effects of THC. While there are many claimed benefits from using CBD, only have a few scientific studies to back up those claims. Have you ever considered using CBD? If so, comment yes below. The most studied use for CBD is epilepsy and seizure disorder. In 2018, the FDA approved the use of CBD to treat 2 different kinds of epilepsy for patients over the age of 2 years. So far, this is the only FDA-approved use of CBD. However, recent animal studies have shown promise for the use of CBD for the treatment of conditions including anxiety, pain, inflammation, chemotherapy-induced nausea and vomiting, addiction disorders, depression, acne, traumatic brain injury, multiple sclerosis, sleep disorder, and Parkinson's. Not enough studies have been done to prove or disprove the usefulness of CBD in the treatment of those disorders. However, there are a lot of anecdotal stories of how CBD has helped patients across the world. Used topically, patients report arthritis pain of the hands and feet is relieved. Used orally and sublingually, anxiety is lessened. Some practitioners are recommending that their patients use CBD to prevent or lessen the nausea effects caused by chemotherapy, and they're getting good results. Used sublingually and topically, patients swear it relieves back pain, knee pain, and other joint pain. Patients experiencing withdrawal effects from drug addiction have reported that using CBD oil has relieved the anxiety and depression associated with detox. I personally know a woman who has been able to discontinue all of her fibromyalgia medications, is currently only on CBD, and is nearly pain-free. This is saving her over $300 a month on her medication copays. While the placebo effect may come into play, how much of traditional medicine effects are also dependent upon the placebo effect. More research is needed to validate CBD claims. Have you ever used CBD oil? What did you use it for, and what were your results? Tell us about your experiences with CBD, either good or bad, in the comments below. I spoke with Dr. Cody Freeze, who is a pharmacist and owns the CBD oil company Inspiro, and asked him what he would like people to know about CBD products. His first point was to purchase from a reliable company. The reliable products that contain what they claim have a third party test each batch to ensure that the CBD levels claimed on the label are accurate. This testing costs money, so the better quality products will be more expensive. Supplement companies in the United States are not required to test their products to ensure every batch contains the amount of active ingredient reported on the label. The truly reputable companies will have a third party test each batch to prove that you are getting what you pay for. If it's cheap, you may not be getting as much or any at all CBD as advertised. As with anything, you often get what you pay for. Dr. Freeze also said to be sure that you purchase a product that has a certificate of analysis showing that it is absorbable, whether through the skin for topical application, sublingually, or orally. While water-soluble products that are made to be dissolved in a beverage and drank are good products, they do have some drawbacks. First, they are more expensive since it is difficult to make them water-soluble. CBD is naturally an oily substance, so making it water-soluble is difficult, but there are some good products on the market. Because the water-soluble products go through the digestive system, they may not be absorbed as well and will go through what is called first-pass metabolism. First-pass metabolism is when the liver changes the original substance into an inactive substance. CBD undergoes 90% metabolism, which means that 90% is inactivated before it can even be used by the body. By using a sublingual oil and holding it under the tongue for 30 to 60 seconds, the CBD goes straight into the bloodstream and is more bioavailable. Bioavailable means more of it works in your system. Another point Dr. Freeze wanted to stress is that you must give the CBD time to work. If you are using a topical application such as a cream for rash or inflammation, you will probably get some relief within 1 day. If you're using the oral or sublingual products for pain, anxiety, nausea, or other issues, it will probably take 3 to 5 days for it to start working and 3 to 5 weeks before you see a maximum benefit from the CBD. Finally, make sure that you consult with your pharmacist or your physician to ensure that you are well informed to your particular circumstance in order to have a safe and effective treatment with CBD. CBD is a drug and should be treated that way. By checking with your pharmacist, you can avoid drug interactions and other problems if CBD isn't the right choice for you. While CBD is very safe for most people, it isn't safe for everyone. Inspiro is a reputable brand of CBD products that does use third-party testing to ensure that you are getting what you pay for. I will leave a link below to the website so that you can check out these excellent products. If you think this information has been helpful, please give it a thumbs up and share it with your friends. If you have any questions about CBD, leave them in the comments below and I will do my best to answer them. I hope this video has answered some of your questions about what CBD is used for. Thank you for joining me today. Have a blessed week.